Thank you so much, Amir, for the introduction, and hello, everyone. It's nice to be joined by all of you today. I know there's many things we're all juggling in this pandemic time, and so it's nice to know that we can take some time out to hear each other. I'm joined by my distinguished colleagues, Lynn and Michael, who you will hear from as well as we go through this presentation. So just to remind you of just the objectives of the webinar, in case you had forgotten or it's helpful to have a reminder. So we want to, sorry, I'm just playing around a little bit with these icons here so I can see my own slides, apologies. So we want to cover in this webinar the understanding the complex environments in which decision makers operate. It'll just be a snapshot because it gives us a little bit of background to why issue briefs might be a helpful tool. Also want to go through a little bit about appreciating the various influences on decision makers and decision-making processes. And then zone in particularly on what is an issue brief as a research communication tool for decision makers. And then hear from Lynn and Michael about their particular experiences as they've used this tool to influence change in their contexts. So, as we think about how to engage with stakeholders or to develop an integrated knowledge translation strategy, what we always have to think about in mind, and it's a bit of an iterative process, but some of the main elements to think about is for your issue or your particular problem that you're dealing with or the policy you might be engaging with, you know, who cares about it? Who has a stake in it? And once you've determined who the stakeholders are, it's important to then for each stakeholder, try to determine why you want to engage with them. And there might be many reasons for engaging with them, and I'll go through a couple of those with you. And once we've determined, well, why do we want to engage, then we have to think about what's the appropriate message. How do we frame our message in a way that suits our purpose and the goal of the engagement? And then how do you share that message? What's the appropriate forum or medium? And those are the 4 parts that I'll focus on in this webinar, because we'll stop at the medium being the issue brief for this example. But the other things one has to think about is, well, who is the appropriate person or people to share that message and that particular medium? And it's not always us or the researchers. It could be a knowledge broker. It could be the dean of the school, for example. It could be someone that's got a better relationship with the media than we do. And so it's important to think about, even if the first 4 steps are determined by the research team, that who necessarily would be the appropriate person to convey the message. And then there are particular times that make more sense in a policy cycle or in a practitioner cycle, or even if you're dealing with the media about when to share that message. And obviously not all of these and if I can ask everyone to please mute their mics so we don't get a little bit of, I think we're getting a little bit of echo there. And these all take resources. So, you know, for the strategy that you determine, you might have to consider whether you need specialized skills in your team, whether you need to put a budget towards creating some of these mediums. For example, if you decide you want to do radio spots or infographics, and if you need someone that's specialized in that, all those kind of examples. Amir, I wonder if you can help me mute anyone that's not muted yet. That might be helpful. Thank you.
Yeah, will do. Thanks.
And so, thank you. So as we go through these 4, I'll just do them really briefly so we can spend more time on the issue brief. So if we focus on the first part of the strategy, and you've identified a number of audiences or stakeholders that likely have a stake to care about your project or your problem, both positively as well as negatively, the things you kind of want to think about is, you know, what kind of power do they have? What kind of influence do they have in terms of positively or negatively influencing either your success or the project or the policy or the issue that you're focused on? and what kind of interest do they have and what is the impact on them. And it might be quite different for different stakeholders. So then the question is, after you've done a stakeholder analysis, which is a really important first part of all of this, then how would you prioritize? And there's different ways about thinking about prioritizing. So you could decide, if you created a power interest grid, which is a tool you can use for stakeholder analysis. If you were to look at that grid and you could focus on people that have the highest interest or highest power, these people are obviously often have they can enable or prevent your particular objective. So for example, someone really high up in the power grid for health work could be the Minister of Health. The topic may or may not have his or her interest, but they often fit in that part of the grid. So you could prioritize by interest and power. It could also be that you really want to get a lot of cooperation, and it's really necessary and highly desirable to move along a topic or an issue that maybe hasn't had much traction yet. And so it could be that you really want to prioritize people who don't know much about the issue, but they still have a lot of power. So for example, county health commissioners in countries like Kenya, for example. And that might be one way of prioritizing, depending on what your objective is. So there could be another focus could be on those that are greatly impacted by your project, but they don't know much about the issue, and they don't have much power in the way that we traditionally think about power. So it could be, for example, adolescent girls in rural areas. In your grid, they may appear that they have very low interest and low power, but you think that whatever decisions are made, they're going to be the ones that are most impacted. And so their interest and power isn't of value and matter to you, but you really want to focus on them and prioritize them and engage more with civic society and civil society, because that's where the greatest impact is. Sometimes you have to be a lot more strategic and think about prioritizing who you want to engage with based on their ability to serve as important intermediaries or brokers in a system. So you may not necessarily have relationships with the people you really want to impact, but there are others that have those relationships and you want to be able to leverage that. And similarly, your funders or country representatives of your funders might also be strategic, prioritized stakeholders as you think about who you want to engage with. And the prioritization becomes really important because there are so many people that you probably have on any kind of stakeholder analysis, and you can't engage with them all, and you have to think about really what you want to achieve, and therefore how does that guide your prioritization. Once you've chosen your stakeholders, it's important to then go through each one and decide, well, why am I engaging with this particular stakeholder? What's my purpose for engagement? And there could be several. You might want to just raise awareness and interest on a particular new project, program, new research that's come to the fore. I mean, we're hearing so many new things every day in the COVID era, but also in non-COVID related topics, but they intersect of something really important. It could also be that there's a lot of misinformation, misunderstanding about a particular issue, and you feel like the reason to engage with a particular stakeholder is really to assist with more clarification. It could be that you want to engage because you really want to compel them to policy or public action. And it's not necessary that you may not, that you have only one purpose to engage with a stakeholder. It could be that you want to engage with them for many reasons. You want to first raise their awareness and interest in a topic, or that they're already far ahead, and what you need to engage them with as a first step is to clarify, and then as a second step, to compel them to policy and public action. So exclusive, it could be that your stakeholders are at different points in the continuum of their understanding of a topic, and that can guide the next step, which will be, once you've determined your purpose, is then, well, what do we do? What is the message to convey that purpose, and how do we then make sure that we are effective and successful in our engagement? So it could be that there are other reasons to engage, like you want to leverage relationships, or you want to leverage the skill set of another organization that does advocacy, because that's not what you do. But in order to reach your ultimate objective, you need an organization that can help you with that. Oftentimes when we do stakeholder analyses, we don't always look at the relationships between stakeholders, and we don't always think about coalitions, or we don't think about how they relate to each other. So sometimes it's really important to think about alliance building. You could be engaging because you want to mobilize more resources, or just to promote your results. So depending on the various reasons you want to engage, and it has to be a deliberate exercise to decide on why you're engaging, because that then influences your next step, which is once you know the purpose for engaging, then you have to carve the appropriate message. What do you really want to say? Now, these messages have to be tailored to your stakeholders. So you can't necessarily always use the same message for different stakeholders, and you can't always use the same message for the different reasons for engagement. So for example, if you want to engage with someone because you want to clarify an issue, that message is going to be very different from, I need you to do something about the issue. And so it has to be obviously linked very much to the purpose for engagement and tailored to your audience. And you want it to be digestible. So depending again on your audience, you can decide what kind of complexity of language you can use and ensure that it's really relevant and timely. So the WHO has come up with guidance on 7 C's for effective communication. And they suggest that the message needs to command attention. It needs to be very clear. And oftentimes, as we all work with stakeholders, we recognize that the question in the back of everyone's mind is, well, not what's necessarily in it for me, but how do I benefit and how do my constituents benefit from me engaging with this issue? So you want to be quite clear in why it makes sense for them to engage, what could be the equity concerns, what could be the financial implications of engaging, what could be the social implications of doing something about this particular problem. So it's very important to communicate a benefit, not necessarily that you perceive as a benefit personally, but that you understand as a benefit for your stakeholder. And if you're engaging with them multiple times, try to be as consistent as possible. Otherwise, you risk obviously damaging the relationship, or you risk creating confusion or distrust. And the one thing I find really interesting here is about the one about catering to the heart and the head. And I think as scientists, we often think about, well, what are the facts? What's the logic? Where's the data? Where's the evidence? And what we often forget is that we're still dealing with human beings, people that have values, people that have experiences to bear behind the issue. For some, it's a really personal topic, and for some, it's laden with moral and ethical considerations. And so it's really important to think about everyone we engage with as human beings, and therefore you have to cater to the heart and the head. And the relationships will come up over and over again, and you probably know this from your own engagements with stakeholders, and when you're creating outputs or trying to communicate and do any kind of knowledge translation, that so much of this depends on trust and relationships. The last one is an interesting one because I think it appeals more when your message is about compelling someone to action, and that call to action has to be really clear. And we'll come back to this when we talk about why that's also important in the issue briefs and what kind of feedback we got from decision makers as they were receiving issue briefs. So here are some examples in terms of the purpose matched to the message. So for example, if you want to raise awareness and interest, one example of a message could be, we have just received $3 million from USAID to research the social determinants of non-communicable diseases. If you want to enhance information and understanding, the message could be, poverty, insecurity, and gender discrimination in poor urban neighborhoods are hindering access to NCD services. If you feel like it's a problem of misunderstanding and you want to provide some clarification, if we think about the same topic, Another example of a very clear message could be, the identified determinants do not preclude clinical NCD concerns, but rather provide more context to the challenges for prevention and treatment. And if you really want to compel someone to action, you could say the Department of Health needs to align with other departments and provide budget to address the insecurity and the transport issues faced by the urban poor, if indeed we want to reduce NCD prevalence. These are just examples, but hopefully they provide a little bit more context to some of the abstract pages I just went through, and hopefully that's useful. So then how do you increase the impact once you've determined what the message is? And I think this comes back to the context complexity that we all work in when it comes to trying to influence decision makers, is one, to recognize that they have many other issues that they're grappling with, and that there are many other influences in the decision-making arena that determines whether your particular intervention or evidence is important, because we have to remember there are other researchers out there. There's lots of evidence that's coming to the fore. Different people have different relationships, but there are also lots of other priority issues that they're trying to balance, that cuts across different sectors, but has budget implications, that has timing and equity and equality considerations, and diplomatic and political considerations as well. So there's so much going on in the complex environment of decision making that you kind of want to say, well, how does my message not get lost? And there's people that have more power than me, like, you know, lobbyists and advocates that probably have more money and power to engage with decision makers. So the least we can do is at least make sure we do a few important things. So make sure, well, these are just some suggestions, and I'm sure many of you have other suggestions based on your experiences, so feel free to add to this. But it has to be relevant to their priorities. If it's a topic or an issue that's not relevant to their priorities, it's not likely it's going to have much impact. And we talked about their interests as well, and their particular values. The results with low uncertainty is something that's important for those of us that really want to push evidence-informed decision-making or support evidence-informed decision-making, is if the results of the research or the evidence have great uncertainty and we just don't know, then those are really hard in some ways to support and push forward with, without the caveats that come around with that. And given that decision makers, so many lives are often dependent on the decisions that our policymakers and practitioners are making, they want to also weigh the risk of moving forward with a potential intervention. And so the less risk there is, the better. And if there is high risk, the more information you give about how to balance those risks, the better it is for you. We spoke about timeliness already, as well as the language being comprehensible and not too abstract, but obviously it depends on your audience and their comfort with the jargon that you may want to share. And so keep in mind what it is, your understanding and background of the decision makers as you are shaping your message. And of course, we come back to leveraging the importance of relationships between researchers and users. And so as we think about motivating decision makers, we come back to the head and the heart a little bit, is you have to think about how your message speaks to the importance of logic. So the science and facts have to be there, but also what a decision maker will feel, and then what they actually care about. So these are broken up into logic, emotion, and then character. So as we move to the last part, which is what kind of ways would you then package this particular message in? How would you share your message? There are many different ways of obviously sharing those messages, as long as it's responsive to the audience, their needs and preferences. That we meet, you know, every quarter? Would you prefer that we meet weekly? When we meet, what kind of information would you like? And would you like it packaged in a policy brief? Would you like us to send you the entire journal article as well as a summary? It's really helpful to understand what your stakeholders actually want. And that might result in a multi-pronged approach. It might result in the fact that you have to create multiple products or engage in multiple ways. And it also means that you may not feel comfortable in engaging in all these ways and need to think about how do you enhance your team. And so we all probably have lots of examples about engaging through print and print medias, face-to-face, more personalized ways. Social media has become a more popular way right now to complement and supplement the way that we're communicating with each other. And we might also need to think about, like I said, a multi-pronged approach and some kind of compendium of all of these. So there are others, other ideas that have come from all, people that have been working in this field for a while, and not all of them are probably relevant to every circumstance. But here's a list that might be useful to think about, but also, if you haven't heard of them, to consider, but also to reflect on the ones that you have been engaged in, like testifying before legislative, or act with your particular policymaker, creating a policy brief and then using that to convene a policy dialogue. So given that there are so many mediums and forums out there to engage with decision makers, we're going to focus on just one for today, which is why you've all joined us, and that's particularly on creating an issue brief. And I'm sure many of the questions in your mind is what's the difference between an issue brief and a policy brief, and that's a valid question, and I'll come to that. So let me give you a little bit of the history of why we've developed issue briefs. So in 2009, I was part of an advisory committee by WHO that really felt that there was a big disconnect in terms of going from a research article to a policy brief, and really was exploring a tool that serves the purpose between the two of these. And so we created what we call, and many people are using now, what's called an issue brief. And that allows you to share the results of a research project that may be able to serve multiple purposes, not just compel you to action, but could also help with clarification of a problem. It could bring new information to decision makers, but it also could be used for a multitude of different kinds of decision makers. So there was this recognition that a policy brief generally would be used for policy decisions, but what if we needed to provide decision makers with practical decisions about an issue in the community that needs a solution, or a problem in health service industries that need some kind of action, or we're having trouble with implementing guidelines, or we're finding that too many healthcare workers are being infected by TB, what needs to be done. So very practical needs of decision makers that weren't necessarily policy relevant. So after that, we used it in 2009 for PAHO and with a lot of decision makers in the Caribbean countries, and then workshopped this particular type of issue brief at the ResUp Meetup Symposium in Kenya. And at that point, we requested a lot more decision maker feedback to refine the tool, which resulted in some moving around of particular elements to make it more impactful for decision makers. And then the WHO said, well, let's use this again for researchers in Europe working on multi-drug resistant TB in Eastern Europe. And so then the tool was further revised and further refined in that way. And we've now taken this tool and use it as part of a course at Stellenbosch University, at first for a 2-day face-to-face workshop on engaging with decision makers, with issue briefs being the main output. It was also then requested to be workshopped by Future Health Systems to train public health researchers in East Africa on issue briefs. And we're now offering it as an online 5-week short course, starting actually in a couple of months. And so it's gone through various evolutions, but that's a little bit of the history of it. So now you may be asking, well, what then So tell me, what's the difference? What's the difference between a policy brief, an issue brief, a technical brief? And we see many different kinds of products out there. And while I may go through some of this discussion in terms of the differences between them, I think we've all seen many documents out there that might be titled policy brief or issue brief, but don't necessarily fit the criteria that we see here. So for example, you may all have seen policy briefs that are, 35 pages, 50, 60 pages long, so they don't seem like a brief, but they also don't necessarily provide policy options or policy guidelines. And so there is this balance now about what is attractive and what is actually has the content that we see titled. So if we go through these one by one, I'll focus particularly on the purpose. So what the purpose of a policy brief is to influence policy in particular, to convince the target audience of the urgency of a problem and the need to adopt a preferred alternative or a course of action. Whereas an issue brief can influence action. And that could be policy action, but it could be practice, it could be advocacy, it could also be a management decision. And so we've used issue briefs even in educational institutes to convince the dean of a school about what needs to be done at the departmental level in terms of enhancing relationships between researchers and decision makers. So it's got a little bit, it's a bit more versatile in terms of its audience, but also in terms of its the action that it's trying to recommend. In terms of length, policy briefs, you can have like the full policy brief up to with every detail that you can have in the 1/335 page format. The issue brief, in contrast, is usually 2 to 4 pages. It's very short, and the design I'll show you is about 2 pages long. The content of an issue brief really focuses on priority actions rather than policy recommendations. And it's embedded in also research and study findings. Also, the difference between the policy brief and the issue brief is that policy briefs, it's really important that they are influenced by a body of evidence, not one research study. That can be quite dangerous because you don't want to be changing policy based on one study, but you want to look at a compendium of studies through a systematic review, synthesis, etc. The issue briefs, in contrast, could be, because they're so specific, particularly to a particular issue. It could be a management issue, a practical issue in an organization, or in a study, in a research team in particular. It could be informed by one particular problem or issue or finding. So I hope that gives a little bit of difference between the policy brief and issue brief. But it gives the sense also that that many issue briefs can be made, and they can be made throughout the course of research and studies or practical problems in organizations. So here is the design of the issue brief we've been using. It's a 2-pager. On the first page, on the front of it, you see a little bit of the context, so a very short background, and you would change the title, so it wouldn't say background, but you would actually say what the title of the background is. And then a very succinct problem statement. So what is the issue? Given that this is an issue brief, it's really important to then really be clear about what the issue is, and then what you want your stakeholder to do about it. So the priority actions should be right there. Now, this might seem counterintuitive to researchers because you would usually first put the results or the various points that you want the priority to focus on. But when we got feedback from decision makers, they said very clearly, I want to know on the very first page, what is the problem? So the title of the issue brief has to be a very clear call to action. And they really want to know what you want them to do. Because they said, if I only have 1 minute to quickly look at this, I want to know what you want me to do. So the priority actions are on the first page, and they're limited to 3. And this is partly based, as we all know, in human psychology and human knowledge, that it's much easier to action on 3 items, even though our memories allow us to remember up to 7. But it's very good practice to focus on 3 priority actions. There's space, obviously, to make this more compelling with pictures, relevant pictures or graphics on the front as well. And obviously you can choose the colors that make sense for your organization. And there's obviously space to put logos that are also important. On the back of the issue brief would be the key findings on the left side that come from the study or studies or problems you've studied that link very clearly to the priorities that we saw on the front. So you could have 4 or 5 key findings and they link to the 3 priorities you have on the front. And then it's really important to have an implication. So what are the implications of the actions you're asking your decision maker to focus on? There could be financial implications, they could be staff implications, there could be political implications, there could be economic implications, programmatic implications. But it's very important for your decision maker to know what the benefit, as we spoke about earlier, what the benefit of doing this is. And also, what do you expect if nothing is done? What if they leave it as the status quo? How terrible a decision is that, or is it okay? It's not a train wreck, but it's important for them to consider. And once again, there's space here to use graphics and colors to make this a bit more attractive, and then space at the bottom for you to put contact information as well as your organizational logos or your funders' logos if need be. So that's what a 2-pager issue brief looks like. And here are some examples of previous issue briefs, and I'm only showing you the part on the back, that's the results and how it matches with the priority actions on the front. And it's really important that the priority actions are action verbs like advocate, collaborate, prioritize, implement. And so here are 2 examples that you can see that have been done by different researchers, some that include graphics and some that don't. So, but it's very important that the results match very closely with the priority actions, because if you have a lack somewhere, you want them to do something about it. And then, like I mentioned in the implications, you could think about what kind of implications and break those up. Like on the left side here about, you need stronger evidence synthesis, you'll have strengthened partnerships, there's a feasibility concern and the consequences of inaction. You could also design it more like the person on the right here in terms of different bullet points that are indented in on mass screening and the pros and cons of that. So at this point, I'd like to hand over to my colleague Lynn as she talks us through her example, and I'll look at the chat box in the meantime, her example of using an issue brief to tackle homelessness and the importance of unlocking and releasing all research that already been done on homelessness. So over to you, Lynn.
Hi, good afternoon, everybody. So I am at the Center for Evidence-Based Medicine, the Center for Evidence-Based Healthcare, sorry, not feeling so good today, at Stellenbosch, and I attended the course issue briefs that Nasreen alluded to, the face-to-face one, and during that workshop, I designed this issue brief. So previously I worked at the City of Cape Town for the Department of Social Development, and I was a researcher there, and I did different evaluations of programs, and one of the programs at the city at the time was the homelessness department, and they had several policies on homelessness, and they also wanted to do a census around the number of homeless people that lived in the city and where they are located. After we conducted that research, the research was kept in-house at the city and wasn't released to the media in its full account. Only selected parts of the data were released, but there was quite a lot of information around theoretical insights into why people become homeless, solutions and recommendations from over 2,000 homeless people around solving the issues, what they needed to move off the street. There were countless interviews, quantitative data, and all of this had been sitting with the city since 2014, 2015. And I had been advocating at this point for almost 4 years to get the city to release this information, firstly into publications so that it could be circulated, because there was no existing publications on homelessness from Cape Town, Western Cape, in South Africa. And secondly, to release it into the public domain for other NGOs and people to use the data. Because I was also part of a consortium of NGOs that work with the homeless in the city. There were lots of political motivations around this topic, as you can imagine, and why they didn't want to release some of the information. And at the turn of 2019, I think this is when I started doing this issue brief, there was new management put into the social development portfolio. And I thought with a new director, he may be more inclined to try and do the right thing with the research. And that's how I chose my title about must unlock and release the buried treasure of homelessness research, because it spurred them on to, I need to actually actively unlock where this data is hidden and bring it up to the surface. And it's really a treasure, because what you could do with the data is affect policy, affect change, and also provide answers for the wealth of research that was housed inside of the department. So I wrote a bit in the background, and the pictures I used are actually from the study, and then also the screenshots that you see in the first section, those are newspaper articles that were written because of the study. And then the priority actions that I identified is to transform the results into publications, select a team of people in the own unit to contribute to the publications, and then to establish collaborations between those working in the department currently and the center at Stellenbosch to work on publications together. It was important for me to put those as priority actions so that they didn't feel that we were just coming to use the information to create publications, but also to upskill those working there as to the importance of putting into publications what the research has shown. Because across almost all the programs, there are 0 publications that come from the data that they really have a lot of data. And on the second page, I put why it was important for us to do this. So under the key findings, I mean, to this day, it's now been 5 years later, I still get people emailing me, asking me about the homeless and about the research. There's 0 scientific publications. There have been less than 5 scientific publications on the lived experiences of the homeless in Cape Town since 2009. So these are individual studies with 1 or 2 people. And then lastly, the department has 4 unpublished reports from 2014 based on over 2,000 street people. So this again just alerts them to the importance of what they're holding on to. And on the second page, I made it really clear about the risks and the benefits of not releasing the findings and releasing the findings. I think that sums it up, Nasreen. Hi, Nasreen.
Thank you, Lynn. I'm so sorry. I was struggling to unmute myself and I couldn't find how to. For some reason, I lost the button. Could you tell us, Lynn, what kind of reactions you've had from the decision maker you approached with this issue brief?
Yes, I must say, before this, I've been emailing and speaking to my contacts at the ECD, as well as the MACO member. And I didn't receive a reply for almost 6 months. Then I sent this issue brief to his email and to his assistant, and almost immediately he responded to me and said that he would like to have a meeting for us to discuss this going forward, which was a big difference to what had happened in the previous months. So we arranged the meeting, and we went to the meeting with him, and he had the issue brief with him already. And he said it was very clear, like, he sees what it is that I want. And then he said for me to draft the publication to send to his office, and he would review it to see what exactly I meant by the publication. So the issue brief definitely helped me get to the meeting. And from there, it was up to me then to negotiate with him face to face about how we would go about this. But it did draw his attention, and I got better feedback than just sending an email and requesting time to talk.
And did you get a sense from your decision maker about the, the recommendations or the priority actions that you would like them to do? Did you have positive or negative reactions? Did it seem like you had assessed them well in terms of what's feasible? Did you get any kind of feedback in terms of whether they felt that these were feasible actions and that they could move forward with them? Or did they suggest something different that they'd be doing?
So basically, they did say that the priority actions that I recommended were good and that they could see it working. But I also think I had to be sensitive to the political atmosphere at the time, because I mean, for those of us who live in Cape Town, and if you've been watching social media and Facebook, you can see there's been like a lot going on in the media around the homeless and around the homeless camp that was built in Strandfontein and where people are sleeping. So this is a very sensitive topic. So I think it is dependent on the political climate. I mean, the issue brief got me the meeting, but the political climate still determines whether these points can be actioned.
Exactly. Are there any next steps between for you and the decision maker on some of this work, or is it all in their hands now?
So what I've done now is I'm busy drafting the publication, and then I'm going to attach the publication with this issue brief to an email to the MACO member, and in that email, I will have to tell him that I understand the political climate and I've been sensitive to that in the publication, and ask him to review what I've written, and if we can go ahead with submitting it for peer review. But at this point, I don't think we'll be able to action selecting a team to write with on the paper, given what is happening. I think they've got too much, and I will have to take more responsibility for writing it and letting them look at it.
Yeah, so I think those are good things to keep in mind, is just the political complexity, but how quickly things might change in a situation, and how you have to kind of adapt your strategy accordingly. Super,
Yes.
Lynn, thanks. And if anyone has questions for Lynn, please either put it in the chat box or feel free to ask as we get to the Q&A part. Lynn, was there anything else you wanted to share? Otherwise, I'll invite Michael to share his experience.
I know. I think that was all from my side, Nasreen. Thank you so much.
Thank you so much, Lynn. I'd like to now invite Michael McCall to talk to us about emergency care services and pre-hospital guidelines that he was working on also in this region, and would like to invite Michael to please put on your mic and explain and walk us through, and please tell me when you'd like me to change slides. Over to you, Michael.
Sure, thanks Nasreen, and thanks Lynn. It's really great to see others work as well, the impact it's been having. So hi everyone, my name is Michael, also from the Center for Evidence-Based Healthcare within the Division of Epi and Biostats at Stellenbosch University. And maybe just to give you a bit of a brief background around this issue brief considering closing the gap for pre-hospital guideline implementation in South Africa, a call for action, is really that in South Africa specifically, paramedics who are really practitioners who practice emergency care outside of the hospital, so typically the guys in the ambulances, have been practicing with protocols informed by eminence-informed evidence, really, for the last decade, since 2016, 2017. And the evidence they've been practicing from is pretty much really old. And in 2016, 2017, this decade-old protocols really was revised, and it was replaced by a evidence-based clinical practice guideline, which I was involved with together with a larger team. And this really signaled a very big transition in the entire profession nationally from what has been the current status quo regarding clinical practice to a new standard, really. And it involved a lot of challenges, specifically around behavior change, and consequently downstream from releasing the guidelines, these new guidelines, a lot of challenges around how decision makers should be implementing these guidelines on a national scale across quite a complex pre-hospital environment. And so we set out to do research to try and help stakeholders navigate this really difficult space, specifically around understanding what are the barriers around and perceptions around guideline implementation in pre-hospital care in South Africa. And so we produced a issue brief, which was based on a qualitative study and a bit of various studies around that also involved decision makers. So we actually had a co-author together on this project from National Department of Health, who from the get-go was able to collaborate with us on this research, and in the end produce an issue brief for a particular stakeholder audience, which was the Health Professional Council of South Africa, which is really the regulatory body of emergency care in South Africa, and then National Department of Health. And so we really stated in our issue brief here some brief background, as you can see, some challenges that are being faced among paramedics, and then we listed 4 priority actions that we would like decision makers to be aware of, specifically around promoting the results of our research and what their kind of action should be. We also highlighted some key findings linked to the research and some implications like what Nasreen has mentioned previously. So this was one strategy that we had around getting decision makers to be aware of what paramedics are saying around how they think guidelines should be implemented, and also is acknowledging some of the challenges that paramedics are experiencing regarding the new guidelines. So that was the one target audience, and these issue briefs were sent via email to stakeholders, and we're happy to see that it was taken up to a certain degree. It was referenced and used as part of the task force that was established by the Health Professional Council of South Africa to advise the board on how to implement the guidelines. And so it did come to some action regarding from evidence into action, really, or evidence into policy and practice. How that's actually translated into real life, I'm still not entirely sure, but there are definitely changes that have happened. And then secondly, our second target audience, and then Nasreen, you can go to the next slide, was paramedics themselves. So we did this research and we looked at paramedics' opinions, but we also wanted paramedics to know that across South Africa nationally, that we've been listening to what they have to say about the challenges they've been voicing on social media for so long around these new guidelines. And so we created some research summaries, as you can see there, the top 2 points. And these were interactive kind of evidence summaries, really research summaries, just to tell someone from the get-go quickly, what is the question that we asked? Why is it important? What did we do? What were the main findings? And where they can find out more info. We also had specifically for paramedics and across social media, some infograms that we released just to make the picking up of that information for those who aren't scientists to absorb that information better. And also we created a YouTube video and posted it in the Faculty of Medicine and Health Sciences YouTube page around the research that was conducted, just with the aim of, again, promoting results and making people aware that we'd actually done this research. Because the average paramedic in South Africa just doesn't read any kind of research paper, and they mostly just look on Facebook for their evidence needs, really. And so we wanted to grab their attention and get them to read what we had said. And I'm happy to say that that YouTube video has got almost more than 800 views. So I'm an up-and-coming YouTube star, and hopefully I'll get 1 million by the end of the month, and be able to resign and become a permanent YouTuber. So yeah, so that's just from my side some of the work we've done, and it definitely wasn't without its challenges, but that's maybe something that we can elaborate on if we have time. Thanks, Nasreen. Over to you.
Super, Michael. Thank you. And I think you gave us a really nice example of what a multi-pronged strategy looks like, with the multiple different approaches and mediums and forums you've used to be able to gain traction on the importance of this issue. And I'm going to look for your YouTube channel and become one of your fans. How's that?
Please like it and subscribe.
Great. And it's amazing. It's had so many hits already, and it just goes to show that while we do get creative about some of our print products, that there is something more attractive, fast, and personal in some ways about videos, and something to consider as people think about engagement strategies. And I haven't looked at the chat box, but I suspect that there are questions for Lynn and Michael in there, or you can ask them in the Q&A. So I'll move us straight there. For those of you that might be interested in a full course with support to create issue briefs for policy and practice, the first online course versus the face-to-face course is being offered later this year. And the information is in a very blurred picture here, sorry about that, on this slide, but you can always get more information from the Stellenbosch website or from any of us on the webinar today. And so I'd like to hand back to Amir to moderate the Q&A for us, Amir, and bring us to the end of this webinar. And I hope we're doing okay on time. Thanks, Amir.
Hi, Nasreen. Thanks, and thanks to Michael and Lynn. This was a very insightful presentation. Learned a lot. I think there was just one question that came through, and that is an issue brief supposed to be peer-reviewed? I think, Nasreen, you answered the other questions that Matthews had sent through.
So that's a really interesting question, and to be honest, I haven't ever been asked that question, nor have we ever submitted the issue briefs for peer review. There's always the encouragement that the issue briefs should be agreed upon in terms of their thrust and their requests and recommendations within the entire team that's responsible for the issue brief. And in that sense, it would need to be internally accepted and that way peer reviewed, but not in the sense of an academic publication. Because I think there aren't necessarily very strict methodologies and guidelines. And if you look at the content of the issue brief, it doesn't speak to validity or reliability of findings that need peer review in that sense, but very much about actions that are being recommended to a decision maker based on a particular issue that that team is facing. And given that it could be relevant for any kind of decision maker, whether it's a religious leader, I've used it here during times of COVID to provide recommendations to religious groups about whether they should be opening their churches, and if so, what kind of precautions to put in place. I've used it during COVID to provide recommendations and action items for swimming schools, and whether they should be opening at what point during lockdown and what precautions they need to take into place. And I can't imagine that in the urgency of such situations that these would need to go through peer review, and if peers would necessarily understand the situation that's being recommended. So I think it's an interesting question, but it hasn't necessarily or historically been a an output that's gone through or needed to go through peer review, given the objective of the output, if that helps.
Okay, thanks, Nasreen. Thanks, Nasreen. So there's another question that has come through, and that is the difference between an issue brief and a fact sheet.
So it's a good question, and I think you might find elements of both and either, but the way I would interpret a fact sheet might be different from someone else, but I would assume it's providing just the facts and the evidence, but it isn't necessarily providing guidance on actions, nor is it providing implications of actions or inaction. That would be my assumption, but for the person that asked the question, I would be happy to hear different perspectives. Amir?
Okay,
Back to you.
Thanks, Nasreen. And then there's another one by Razia Adam. Would you say this has more of a role for science communication? I'm not too sure what she's speaking to over there. Razia, feel free to unmute yourself and if you want to clarify a bit more, elaborate a bit more.
I'm just thinking, while Nasreen was answering the other question in terms of whether it requires peer review, and I'm thinking because what you want to do is actually sort of make research more accessible to different stakeholders, that it would actually be able to play a very good role in terms of communicating science. Obviously, it doesn't necessarily just only have to be to the public or lay people, but even just to your peers, academia, government, and so forth. And that's why I'm saying, I think it has a good, the way I see it, a really good role in terms of communicating science.
Thanks, Rose. Yeah, I think that's clear, and I would also agree with you. I think it's one of many products that could be effective, hopefully, in communicating science, and I think that's what we were hearing also from Lynn and Michael, and I think it really does depend on your audience for it. And the nice thing about an issue brief is it could be designed for a variety of different audiences, irrespective of whether it's a policy decision maker or a different kind of decision maker. But it really is a guidance for a decision. It's a decision making tool in some ways. Thank you. Amir?
Thank you.
I know we've only got 3 minutes left, and I see that there's lots of questions coming through.
Thanks, Razia. So we have another one. It's addressed to Michael. We mentioned research summary. Is it the same as an issue brief or a summary of a particular publication or study?
I lost you, Amir.
So there was another one directed at Michael, where they're asking...
I don't know if it's just me, but I can't hear Amir.
Same here.
Hello.
From a question directed to.
Go for it.
So just the difference between a research summary and if it's the same as an issue brief. In my case, the research summary was simply just another way of getting the results or the abstract of my research out in a palatable manner for paramedics. In a typical summary of the research or executive summary form. So it wasn't particularly an issue brief where I wanted to compel someone to action. It was merely just giving them an overview of the results in a palatable manner. And it was a supplement to the research. So someone might look at an issue brief, and if they wanted more information around what research was actually done and the methods, then they might go to a research summary, which I would link into the issue brief or link to a YouTube. So for example, we had a YouTube clip, but if someone wanted to know the science around that or behind it, then they would go to the research summary, and the research summary might link them to an actual official PLOS publication, and so on and so forth.
Yeah, thanks, Michael. I hope my audio is a bit better. So I'm going to take the last 2 questions that came through, and that is another question. My research area is in environmental pollution management. Are these guidelines in health sciences applicable too? And then the next question, issue brief, whether or not they use statistics or statistical tests. So I think those are the last 2 questions. And then the last one, how did you distribute among the paramedics? That's for Michael as well. I think we can answer those, and then that should be it for today. So Michael and Nasreen.
So on the first question, I think regardless of the topic or the issue, I think the issue brief is flexible enough for you to be able to use it for your work in environmental pollution and science, if I got that correctly. I think you just have to be sure that it's the appropriate tool, it's the appropriate way to communicate with your desired stakeholder. I'm not advocating that we use issue briefs for anything and everything. It really has to be a deliberate choice based on the previous steps in creating a really good engagement strategy. So, you know, is this the appropriate tool to communicate the appropriate message to suit the purpose you need to communicate for that audience? If the answer for that is yes, then I would say it should be amenable to that. On the second question, I'm not sure I understand it about statistical tests, but all I can say is if you're trying to share the results of a quantitative study or a qualitative study, I think both of those would be fine, as long as, once again, it's the appropriate tool and what's coming out of that study is some kind of recommendation. And if you are suggesting some priority actions to the decision maker who you think is implicated by the results of a study that has statistical and quantitative results, that would be fine. If I've misunderstood the question, I'm sorry, but I don't think I got it very clearly. Sorry about that. Michael, over to you.
Thanks. So maybe just to answer around how we distributed the policy briefs and other things to paramedics. So we used a variety of platforms, and we did it on one particular day with an a priori strategy. So we used YouTube, we used Facebook, we contacted pre-hospital providers like ER24 and Netcare, and distributed national newsletters linking these kind of summaries all together. And we made sure that in the YouTube and the newsletters, we linked the open access publication to the research so that there's no paywall barrier to the paramedics. And also we linked with bloggers in the African sphere. So for example, Bad EM, who's a blogging group, we asked them to do a blog specifically on this topic. And at the same time, on the same day when the article was released, we released all of these things kind of hopefully at the same time. It was quite difficult to do, didn't get it perfect, but in other words, in summary, we used a variety of platforms to get the information out.
Thank you very much, Michael. And I'd like to thank again Nasreen, Michael, and Lynn for such an informative presentation and lovely discussion. Also, I'd like to thank everyone that attended. Great questions were posed. And yeah, we'll be signing off now, just to let you know that our next webinar is on the 18th of September, and it will be presented by Professor Paula Williamson, who will be presenting on core outcome set development. That will be the title of the next webinar, methods webinar. Yeah, and as Michael said, please like and subscribe our Cochrane South Africa YouTube channel, and do the same for his as well, so you can get his million viewers. Thank you, everyone.
Hi, thank you.
Thanks, everyone. Thank you, Nasreen. Thank you, Amir.
Thank you, everyone.
Thanks, everyone. Bye-bye.
Thank you, everyone.
Thank you. Bye-bye.